Hey Max, so it was great working with you today at NSU Clinic. I thought you did a great job overall. It's great seeing the translation from the classroom to the clinic, and I thought you did a wonderful job. But there were some things I thought you should work on, some things you might want to work on. The first was when you palpated the patient's knee, I noticed that you kind of used only one finger, and you kind of did it in a kind of pushing, jabbing kind of motion. It's probably better if you try to work on that a little bit, try to make that palpation a little bit smoother when you palpate the patient. Something else I think you should work on is, I noticed that when you were doing your interview, I thought overall it was a good job, but one thing I think you should work on was make sure that you don't miss anything. So I noticed that the patient actually had knee issues, and I wanted to make sure that you assess that they had audible sounds, and you didn't say that during the interview. But that was just one thing that I thought you should work on. Overall, I think you did a great job. I think one of the best things that you did the entire day was assessing the patient's positioning. I noticed that whenever the patient got a little fatigued or anything, you reinforced where their body should be during the exercises and how they should respond and what they should be feeling. So I thought you did a great job with that.
Oh, nice.
Thank you.
Appreciate that. It was nice working with you too and everything, just transitioning from the classroom to the clinic setting. But one thing I also thought you did a really good job with was positioning. When giving patient education, I noticed that with the list of exercises that were prescribed to the patient, that you kept the patient in the same position when you were giving them the exercises. So for example, if they had exercises in supine, you gave them all in supine, and then we transitioned the patient to sideline, and then you directed him to go to prone for like the last two exercises. So that was good, and then he can follow that suit just so he's not constantly having to change positions and everything, and then he can realize also to do that with other exercises as well. But just a couple of things though that I did notice. One thing was that with palpation, that while you were communicating with the patient, you're talking about either the medial or the lateral side of the knee, for example, but your fingers were on both sides, so it was like a little bit confusing for the patient. But aside from that though, another thing is that just with confidence, I noticed there were a couple of times where you weren't sure if you were answering a question, or while working with a patient, you knew what to do actually, like you were right with everything you did, but it was just you're a little hesitant at first to jump right in, like you know it and everything, so just go out and do it. You got it though. Yeah, just don't want it to show with the patients and everything, but that was it though.
All right,
Great
thank
job.
you. Yeah, thank you.